Okay, and how do I make a VO2 difference bigger? If I had a graph, let's say, of workload versus VO2. I think I have it here. Okay, here's a graph of VO2, or oxygen uptake, or workload. Okay, so we're going from basically rest through heavy exercise, right? And this is a measure of a VO2 difference. Here's arterial oxygen content, and here's mixed venous oxygen content. So what happens basically to arterial oxygen content as you increase workload? It pretty much stays the same. But what happens to mixed venous oxygen content as you increase workload? It gets lower because you're extracting more oxygen in the muscles. Does that make sense? If you extract more oxygen, there's going to be less oxygen left in the veins when it gets back to the heart. Okay, so let's try this. Increase, decrease, or stay the same. What happens to VO2 as a VO2 difference gets bigger? It increases. Okay, what happens to mixed venous oxygen content? What happens to VO2 if mixed venous oxygen content gets lower? Mixed venous oxygen content gets lower, VO2 goes up. See how that works? Okay, do you remember the components that make up arterial oxygen content? What are the things that make up how much oxygen is in your blood, in your arterial blood? One would be how much hemoglobin you have, right? If you have more hemoglobin, you get more oxygen into your blood. The other one is saturation of hemoglobin. Remember SaO2? It's how many of the binding sites on hemoglobin have an oxygen bound to it. Those two things and a constant determine how much oxygen is in the blood. Questions? We okay? All right, let's do... I've got some sample questions, but if you let me, I'll skip those. We'll go right into respiratory physiology. But questions on the cardiac side. Is that helpful so far? Okay. Basic lung volume measures. Give me a typical total lung capacity measure for a normal-sized adult. What are the units? How do we measure lung volume? What are the units? Liters? So it'll be how many liters?
5.
About 5, maybe 5 to 7 liters total, somewhere in there. And what are the 3 things that in a healthy person, not diseased, in a healthy person, what are the 3 things that control or determine lung volume? Number one factor by far, in a way, is what? It's height. The other one is age and sex. Okay. Who has bigger lung volumes of people of the same height, men or women? And what about older versus younger? Younger. Okay. Let's see. Mechanics of ventilation. If I want to breathe in, what do I do with my diaphragm muscle? When I want to breathe in, what do I do with my diaphragm muscle? I contract it, and it moves in which direction? It moves down. That causes a negative pressure inside my chest, which then pulls air into my lungs. Okay, what do I do when I want to exhale? I essentially take the diaphragm and relax it. And when it relaxes, it goes back up to its normal resting position, which is like an upside down U, right? And that makes a positive pressure inside my chest cavity, and air moves out of my lung. Which one is an active process, requires energy, inspiration or expiration? Inspiration. Expiration is mostly passive because the diaphragm relaxes. You also have, think of your chest cavity, your rib cage, your chest wall as being like a spring on a hinge. When you breathe in, it expands. And then when you relax, that spring naturally wants to compress back and help force air out. So expiration is mostly passive. Okay? Ventilation during exercise, relationship between tidal volume and frequency of breathing. When you first start exercising, you're going to increase ventilation. What's going to be the primary mechanism you're going to use? Are you going to increase tidal volume or frequency of breathing when you first start exercising? You're going to increase tidal volume. But as workload gets higher, as you approach maximal exercise, then which component is the bigger player? Frequency of breathing. You start breathing faster to be able to do it. With ventilation versus workload, as workload increases, ventilation increases linearly up to a point, and then it increases at a steeper rate. Remember that? You did that in your exercise ventilation lab. The point at which that ventilation starts to shoot up higher has a special name. It's called ventilatory threshold. And it occurs at about what, approximately the same workload or heart rate as what other measure we typically get. It's lactate threshold. So what causes that extra hyperventilation, that steep incline in ventilation versus workload that we see? What's the cause?
Non-metabolic CO2.
Non-metabolic CO2 production. And where do we get non-metabolic CO2 production? It's from buffering lactic acid with bicarbonate. Okay? Control of ventilation. Does this all sound familiar? Okay. Control of ventilation. What controls your ventilation? Where is the structure in your body located that controls ventilation? It's located in your brain, in the brain stem or the medulla area of the brain stem. As you have chemoreceptors, specialized cells that are responsive to changes in chemical components of the blood. You have one that's called the central chemoreceptor in the brain. You have peripheral chemoreceptors. The major ones are located in the carotid body and the neck. The central chemoreceptor is responsive to what chemical changes? The central chemoreceptors in the brain are responsive to what chemical changes? PCO2 to the blood and what else? And pH. What about PO2 changes? Central chemoreceptors, no. Okay? So as PCO2 levels rise, what does that do to ventilation? As PCO2 levels rise, ventilation goes up. As pH levels go down, as you become more acidic, ventilation goes up. Okay, what about the peripheral chemoreceptors? What are they responsive to? PCO2, pH, but also PO2. So if you're hypoxic, if you went to altitude or you had some sort of disease where oxygen levels went down, the peripheral chemoreceptors would send a signal to the medulla that would say increase ventilation. Okay, those are chemical factors that control ventilation. Are there any other factors that affect ventilation that can control ventilation? There are two more. Yeah, one is called neural factors, neural inputs. Those are primarily mechanoreceptors in your muscles. As soon as you start muscular movement, there's an afferent signal that goes to the brain that says, hey, we're exercising, you might want to increase ventilation. So the efferent signal going from the brain to the respiratory muscular would be turned on. Okay, those are mechanoreceptors. You also have stretch receptors in the lung. As the lung overinflates, there's an afferent signal to the brain that does what to ventilation? If the lung hyperinflates, the brain would then do what to ventilation? It would depress it, okay? Because when the lung overinflates, if it stretches too much, then ventilation goes down. What's the other factor that controls ventilation? It's temperature. Okay? As temperature increases, what happens to ventilation? Ventilation goes up when temperature goes up. Okay.